Hi everyone, welcome to Chapter 44. We're going to be talking about injuries and toxic exposures. If you begin your practice in a primary care setting or a urgent care setting, it is inevitable that you're going to see little ones that have injuries or have been exposed to things. So there's three main components that you need to always focus your care on within the first few minutes of initial contact. You want to check for the ABCs, the respiratory status, airway circulation, check their vital signs. You want to get a brief history and see what their past medical history is, what events led up to this injury, if there's any allergies or medications that are used, and of course you want to do a rapid assessment to make sure that the function of essential organs are stable. So we're going to first talk about some skin issues, trauma to the skin, and soft tissue. And these are typically listed as abrasions. It's a superficial skin injury that's resulted usually from a fall or friction to the skin. A deeper issue would be an avulsion, which is loss of epidermal, dermal, or subcutaneous layers. It's always important to determine the extent of the abrasion and if there's any dirt, grime, or foreign objects that are seen in the wound. There can be concerns for secondary infections, and those may present as pain, swelling, redness, or warmth. These type of wounds need to be kept clean and redressed and may need to have some type of antibiotic ointment applied daily. And with most of our things that we'll be talking about today, if it's been greater than 5 years since their last tetanus shot, they need to receive a tetanus prophylaxis. Another classification of trauma to the skin are puncture wounds, and these can penetrate at various levels. They are classified typically as superficial or deep-based. Most heal without any complications but can progress if infection sets in, if bacteria has been noted to a cellulitis, a fasciitis, or an abscess. The Staph aureus and the beta hemolytic strep are all normal flora that is found on our skin, but can, with a puncture, get into the skin and cause an infection. The Pseudomonas is something that can be found on the rubber soles of tennis shoes, and if you've had an injury to the foot, it sometimes can be found in a puncture wound to the foot. With puncture wounds, you're wanting to note how the circulation of the area is where the wound has occurred. Is there good movement? Do they have sensation? Often these wounds are presented hours to days after it has occurred, so you want to be assessing for if there's any cellulitis, localized pain, tenderness, any drainage, any redness or swelling. You'll be assessing for osteomyelitis or osteochondritis, and you may see significant tenderness over the bone, decreased use of the extremity, fever. And then when a joint is involved, it's called pyoarthrosis, and that could be pain, swelling, or warmth over a joint that might have had an injury, decreased range of motion, and fever. There's an antibiotic prophylactic table that's found on page 921 on table 44.1 that is good to be aware of. So be sure and review that. Other tests that you might be doing, if necessary, would be some type of imaging. If you're concerned for a retained foreign body, you could be doing lab work, wound cultures, and of course these need to be done prior to antibiotics if there was concerns, and antibiotics only if there was concerns for infection. Next, let's talk about some issues with the toes. Ingrown toenails can be caused by several different factors, such as an abnormal position of the toenail on the bed, issues with the shoes, or some type of trauma or improper trimming of the nail. If there is an ingrown toenail, the goal is to try to raise that corner of the toenail up and out of the nail bed, and putting a little bit of cotton underneath that edge will help elevate that. Having the foot soaked in warm water and maybe some Epsom salts can help if there's any concerns for infection. Will also help with blood flow to the area. Next is a subungual hematoma. That's where there's blood underneath the nail in the foot for likely something being dropped on the toe. These areas can be drained in primary care. Holes put into the nail so that the hematoma can drain. I'm going to get you to look in page 921 of the book for more details on how that would happen. Next, we'll talk about lacerations, and these are deep cuts that could be caused from a variety of different things. They are the leading cause of emergency room visits. In little ones' face, scalp, hands, facial lacerations are common more in males than females. They can be caused by shearing injuries where a sharp object can damage the tissue. These typically heal quickly. They can be caused by tension injuries where a blunt force can damage the tissue. And then, of course, they can be caused by compression injuries where there's a crush injury. It's important to determine the cause and when the injury occurred. With these injuries, depending on where they are, you want to be able to do a neurovascular exam and be able to assess for range of motion, so that if you are approximating the wound's edges, you know that those are not going to be pulled, and will give more information on what type of suturing you would do or how to best repair the area. Pulling those tissues together can happen with sutures, staples, glue, tape. If there is a significant wound to the face, the hands, the genitals, those are likely best referred to orthopedics or plastic surgery. One of the key terms that you will hear with lacerations is the decision to close the wound. Most wounds are closed as soon as possible to help the healing process and prevent infections. And it also improves the cosmetic look of the area. But there are times when you would not close the wound. Delayed closure can increase the risk of infection, and there's some research to support that there's a golden window of wounds needing to be closed in the first 6 hours. And animal and human bites should be left open to heal from the inside out from granulation of new tissue. When making the decision to suture a wound, you need to think about anesthesia. Local anesthesia may need conscious sedation for children. Depending on the area, management of hair, shaving increases the risk of infection. Often clippers are used just to bring that hair down to a minimal amount, especially if it's in the scalp. Areas will need to be irrigated, and then the surrounding area needs to be cleaned to decrease any possibility of infection. Before suturing, you're going to want to assess for any foreign bodies, deep tissues, damage, and with that deep tissue exploration, trying to assess for any nerve or blood vessel damage. If there's any unattached tissue, that can be removed. And then based on the location, we'll tell you a little bit more about what type of wound closure you're looking for. Sutures would be in a simple, uncomplicated laceration. Staples can be used in the scalp, the trunk, extremities. Surgical tape could be for small superficial wounds, and then skin adhesive for wounds that have clean edges. You'll need to educate the child or older children or parent about the best ways to dress the wound. Make sure that immunizations are up to date. Antibiotics are only indicated if there's concerns for infection, and then being sure to make arrangements for suture removal based on the location of the injury. Next, let's talk about burns. The literature says over 300 children a day are treated for a burn injury. These can be signs of abuse. If it's an intentional burn, it can occur from grills, hot liquids, house fires, Little ones have thinner skins and have a greater risk for deeper burn. Burns can be broken down into the depth being superficial, partial thickness, and full thickness, and then full thickness with extension into deep tissues. I'm not going to go into the patho of these, but you can review those in your book. One thing to be aware of with burns in little ones is the rule of nines, and that's the body surface area and the percentage that has been burned. That can give more information on treatment and prognosis. On this next slide, I think I have an example of that. With burns, always need to make sure that you have a secure airway, and then can begin your assessment of the depth of the burns. Labs and that may be required include CBC, metabolic panels, clotting studies, pulse ox, and possibly blood cultures. These are likely all going to be cases that you may refer to an emergency room, even though they are saying here admit if the burn is greater percent of 20% of the total body surface area. It's not the biggest here, but you can see that we have older child, and adult. Each of the areas of the body have a different percentage of the amount of area that's been burned, and then goes into that calculation of the rule of nines. Feel free to Google that and you can see better pictures. I'm sorry, I don't think any of these pictures would be big enough for us really to see the percentages. If you have a child that has a circumferential burn, that meaning going all the way around, burns that involve the hands, the feet, the genitalia, the perineum, or joints, those all should be in the hospital setting. Chemical, electrical burns, if there's any underlying chronic illnesses, or if there's concerns for an unsafe environment. Management of these burns will be based on the extent, but it's important to educate parents and the patient that sunscreen is needed on any burn for at least 12 months. Trying to have a healthy and safe environment to prevent future burns is important, and for families and patients to be aware of first aid measures for burns. Okay, let's next talk about contusions and hematomas. A contusion is where you have unbroken skin with an effusion into the subcutaneous tissue caused by a blunt trauma. These are most often the result of falling or bumping into an object during play. A hematoma is a localized collection of blood that is within a confined space, and it's a raised and palpable bruise. With these, it's important to assess and follow for any potential infections. On your assessment, you're going to want to know the cause, the history. You're assessing for circulation in the area and noting if there's any motor or sensory function deficits. Management would include RICE, rest, ice, compression, and elevation, any analgesia for pain, 24 to 48 hours after some warm compresses to help blood flow to the area, and if there's severe injuries, then they need to be referred to orthopedics. Next, let's talk about some bites and stings. These can occur from bites, stray animals, from pets, stray animals, humans, insects, spiders, etc. You're going to want to assess for the cause, the type of the bite, the size, the depth, sensation after the bite or the sting, and any changes in range of motion. If there's a concern for infection, then you may want to do aerobic and anaerobic cultures. And if the area is involved with a bone or a joint, then doing x-rays may be needed. Immunizations need to be up to date. Review tetanus status and rabies vaccine may be needed. Rabies prophylaxis may be needed depending on the bite. Need to assess for anesthesia if they need analgesia. Does the area need to be irrigated or debride? Antibiotics would be needed prophylactically for a human or a cat bite, and for the hands, puncture bites or wound overlying any bone fracture, any crushing tissue injury, or areas that involve tendons, muscles, or joint spaces. Your first line of choice would be considering amoxicillin clavulanate. And then if you have someone that's penicillin allergic, consider a cephalosporin or a Bactrim plus clindamycin. There is controversy on whether to suture or not suture bite wounds. So you need to take into consideration the location, the type, and the depth of the wound. Bites to the hands or the feet should not be sutured but should be allowed to drain. Bites that are greater than 8 to 12 hours old should not be sutured. And facial wounds can be sutured up to 24 hours after the wound. One of the complications is infections. And most common organisms are streptococcus and staph. With dogs and cats, there is an organism called Pasteurella multicotia, and you can get an organism, if it's a human bite, called Echinella choroides. In the education area, it's important for parents to educate their children to stay away from stray animals and caution around animals that they are not familiar with, and to have parental supervision when playing with pets. Next, let's talk about some stings that can occur from bees, hornets, yellow jackets, ants, wasps, etc. You can have reactions from any type of bite, and this is based on an IgE hypersensitivity that's causing the reactions. Histamines and leukotrienes and prostaglandins are released, and you may have local redness, itching, pain, swelling, and generalized urticaria. Other reactions could include watery eyes, hives, difficulty breathing, wheezing, difficulty swallowing, weakness, dizziness, and there can be an anaphylactic response as well. Management includes removing the stinger, applying cold compresses, using some antihistamines, and possibly needing some topical steroid cream. For a moderate to severe reaction, you could use oral antihistamines, steroids, bronchodilators. If anaphylaxis is a concern, transport to the ED. If it's known that this child does have anaphylaxis and carries an EpiPen, then use that first and then the antihistamines, and always wanting to maintain oxygen levels. If there's been a life-threatening situation, you'll be referring to an allergist. It's also important that these patients wear a medical alert bracelet and carry EpiPens. Other things that can cause bites include mosquitoes, more of a local skin reaction. We can have bites by fleas and ticks, chiggers. You're likely going to see local irritation in children that have not been exposed to the bite before. You could have some wheals noted to the skin. The area may be itchy, and secondary impetigo may occur because of the child itching, so be aware to look for secondary signs of infection. Other bites, such as with fleas, there can be an urticarial wheal or a papule with redness. You can also have grouping of multiple lesions from these bites. With chiggers, they have a discrete red, bright area, small 1 to 2 millimeters, mostly on the legs and the belt line, and can cause intense itching that decreases over 5 to 6 days. For all of these areas, treating the symptoms, cool compresses, topical corticosteroids, anti-itch agents, oral antihistamines if necessary, avoiding exposure or eliminating the cause. Insect repellents can be used when children are outside, protective color, neutral colored clothing, and avoiding any scented products. Next, we're going to talk about ticks briefly. There are several different types, and they can cause different issues. There can be the rickettsial infection caused by the Rocky Mountain spotted fever. There's the Colorado tick fever, ehrlichiosis, and Lyme disease. We know that these ticks can be found in grass, shrubs, vines, and bushes. For Lyme disease, the tick needs to be attached for approximately 24 hours. Lyme disease is more of a regional disease. Different ticks are noted in different areas, so it may be more specific to where you practice. And then also it's important to know where the patient may have been, and that will help determine more about what concerns you may have based on infections related to ticks. You're going to see a hypersensitivity reaction where you could have papules, bulla, ulcerations, necrosis. With Lyme disease, you can have a lesion with a reddened halo for up to 1 to 2 weeks. With a rickettsial infection, you can have fever, headaches, myalgia, pulmonary issues. And if any part of the tick is left in the skin, you can have itchy nodules that may last for months to years. On physical exam, you're going to want to be assessing for any high fevers, chills, headaches, malaise, body aches. Treatment for this fever would be with tetracycline or erythromycin. There can be conditions where there is tick paralysis that can occur 4 to 6 days after attachment, and then a rash that can develop, redness and rash, 2 to 3 weeks after being bit. Management includes removal of the tick and treating any illnesses associated with it. Avoid areas of infestation. Patients and parents should wear protective light colored clothing, use DEET containing repellents, and the most important thing is to do tick checks after exposures, and check everyone from head to toe, head, scalp lines, hairlines, in crevices, in folds, bends, etc. Next, we're going to talk about spiders and scorpions, and the black widow has a shiny black back with a red and orange hourglass marking. The brown reclusive is a lighter colored with a darker shaped brown violin band on the back. Scorpions have the stingers and the tails. They're more nighttime and found in the southwest and the southern U.S. So specifically, let's talk with the black widow. You may see asymptomatic area and mild pain. It may have a blanched circular area. You may see in your patient tremors or weakness, shaking. That can occur anywhere from 30 minutes to 2 hours after the bite. If the bite occurs on the face, there can be facial swelling, or, with this type of bite, there can be facial swelling or generalized redness in children. You can have muscle rigidity and tenderness near the bite. With the brown recluse, you're going to notice 2 small punctures, wounds with redness around them. There can be central pallor, usually painless, or a mild burning sensation initially, increased pain over the first 2 to 8 hours. The area that has been bit can become dark and depressed over 24 to 48 hours and can take on a eschar and ulcerated appearance. The child can have nausea and vomiting, fever, myalgia, malaise. With the scorpion, there's usually minimal swelling. You can have systemic reactions where there's abnormal eye movements, blurred vision, restlessness, shaking, jerking. Children that are higher risk for severe symptoms or death based on a scorpion bite. Management includes referring to a specialist, cleaning the wounds, medications for pain, nausea, watching for necrosis, and having shots up to date. Education is so important for prevention, monitoring environments, and to receive prompt treatment if there's been a bite. Snake bites, we're just going to talk about this briefly. Venoms contain different toxins. Cytotoxic could cause localized pain and swelling. Hemotoxic, you could have hemolysis, activation of the fibrinogen cascade, and thrombocytopenia. Neurotoxic, you can have paresthesia, seizures, altered mental status. On your physical exam, you're going to be looking for local reactions, pain, burning, swelling, discoloration. You're going to want to watch proximal extension of the bite in the few hours afterwards. The child could have weakness and numbness and tingling. There could be changes in taste, nausea and vomiting, bleeding issues, respiratory distress. Labs may include coag studies if indicated. If the snake was non-venomous, then clean the wound and make sure shots are up to date. If venomous, then needs to be brought to an emergency room setting where anti-venom treatment can be provided. Education is important. You would want to splint the extremity to minimize movement and try to decrease any venom that's moving up the extremity. No restrictive clothing, caffeine, alcohol, or drugs that might increase the speed of metabolism in the body. Clean the wound. No tourniquets, compressions, or ice packs. Transport immediately. And lastly, heavy metals. Review these in the book. These can include lead, mercury, and arsenic. And then pesticides can affect all body systems. They are known to be nephrotoxic. Depending on the pesticide, depends on whether there's an antidote available, and then educating parents on preventing pesticide poisoning. That is the end of this chapter. Thank you for listening.